Good morning, students. Welcome to today's physical education class. Today, we are starting with the topic injuries in sports. Today, we are discussing bone injuries. The topic is from Unit 7, that is Physiology and Injuries in Sports. So, let us begin the class. So, let us start with heart tissue injury. What is heart tissue injury? We can say it the bone injury also. So, what is bone injury or heart tissue injury? Let me explain you. Bone injury is a serious injury and it is very painful. If bone injury is not handled properly, it may lead to permanent disability, thus to be handled by an expert doctor. The first aid steps are to immobilize the part and to stop bleeding by ice therapy. In this way, further damage can be avoided. Bone injury can be classified as dislocation or fracture. It is again of various types like simple or complicated in which blood vessels or nerves are damaged. Now, what is fracture? In this injury, bone break up by some external pressure. There may be slight breakage or complete breakage. Further may be simple or complicated. Incomplete or wrong treatment of fracture is very dangerous, thus to be handled by an expert. First aid steps are to be stop bleeding and restrict further movement of the part. Further take the victim to the hospital at the earliest. So our first fracture is stress fracture. So what is stress fracture? A stress fracture is a crack in a bone. It can be common injury in high impact sports such as long distance races or basketball, etc. Such type of fractures can be very painful. However, these fractures usually heal themselves if proper rest is taken for appropriate duration, which may be up to 2 months. Usually, these fractures occur in the leg bone. Treatment of stress fracture. So what are the treatment for stress fractures? Apply ice to the affected area for 24 to 48 hours. If pain persists, give some painkillers. If there is any need of immobilization of the affected area, use a splint. When swelling is reduced, start putting partial weight on the affected area. Crutches or walking stick may be used in the beginning. After 2 weeks, start putting normal weight. For 6 to 8 weeks, avoid the activity that cause stress fractures. Then start doing the activity gradually or slowly. Green stick fracture. A green stick fracture is that fracture when a bone bends and cracks instead of breaking completely into separate pieces. What will happen? The bone will not break in separate pieces. This type of fracture usually occur in children because their bones and are soft and more flexible than the adults. So treatment of green stick fracture. So how to treat this fracture? Most of these fracture involve arm and leg which require immobilization to make the bone grow back together in proper or natural position. A removable splint is the most recommended one among children. The swelling that occurred on the site of the fracture may be reduced with anti-inflammatory drugs. Pain can be relieved by taking pain relievers. Generally, it takes 8 weeks for complete bone healing. High impact activity should be avoided in the beginning. So next is communicated fracture. What is communicated fracture? When a bone is broken into two or more pieces, it is called communicated fracture. Such type of fracture is possible in cycle race or motorcycle race. You can see in the picture bone is break down in 2-3 pieces. So that's why we called it the communicated fracture. Treatment of communicated fracture. The management as well as treatment for communicated fracture is not an easy job because of many fragmented pieces of bones. Immobilization above and below the fracture area should be maintained with the help of plasters and splints. For pain management, especially in arm fracture, painkiller should be given to the affected sportsperson. Infection should be avoided by giving antibiotics. It may take for more than few months to restore to its normal condition. After that, physical therapy should be used to treat completely, or otherwise you can do the rehabilitation exercise after that. Transverse fracture. Transverse fracture. It is a break in one of the bone of the spine or a part of it. It is shaped like a wing. Most probably these injuries occur in the thoracic spine, the upper and middle part of the vertebra and lumbar region, or low back area. Treatment of transverse fracture. If the injury is limited to a break of a transverse process with no other injury, hospital care is not necessary. Medication for pain control should be given. Limit the various activities. So limit the various activities. In interactive or multiple fracture of backbone, there can be damage to spinal cord and may require operation. There can be pain and stiffness in the back for some weeks after transverse fracture. Complete rest should be given to the person. After that, the affected person should not join in any activity. Neck and back braces may also be helpful in reducing pain and increasing mobility. Exercise should be done to improve motion and to strengthen back. Next is oblique bone fracture. An oblique bone fracture occurs when the body is broken diagonally to the axis of the bone. Mostly these fracture occurs at the humerus or femur's bone. It means those who are long bones or big bone of our body. Treatment of oblique bone fracture. How to treat this fracture? The method of treatment of oblique bone fracture usually depends on the amount of damage to the bone. If the damage is minimum, a plaster cast may be used to treat the fracture. However, in most of the oblique fracture, surgical treatment is required. If the damage is extensive, metal rod and screw are used to hold the bone in place. Next is impacted fracture. When the end of a fractured bone enter other bone, it is called impacted fracture. It means when a bone broke on one side and it enter into the other bone, that's we call the impacted fracture. Treatment of impact fracture. If the damage is not too severe, a splint or sling may be enough to hold the fractured bone in place so it can heal correctly. If an impact fracture only involves a few bone fragments and the damage is not too significant, immobilization may be enough to treat it. The movement of the affected part should be minimized for quite some time, even after a splint is removed. These fractures usually take more time to heal. In severe cases, surgery is required. So after this, here are some important questions. Please try to solve it. If you face any difficulty to solve it, please let me know in the comment section. So let's have a look what we studied today. So we studied the hard tissue injuries that we call the bone injuries. Then we studied the fractures, different type of fracture like stress fracture, communicated fractures, oblique bone fracture, impacted fracture. Then we have studied the rehabilitation process. Then steps of treatment of fracture, how to treat the fracture. Then last we studied the important question. So here we came to end of the topic. So before that, please like, subscribe and share my YouTube channel for upcoming videos.